China has made huge strides in public health over the last 7 decades. In 1850, average life expectancy was just 32. It remained the lowest in the world for the next 50 years. In 1949, the year of the founding of the People's Republic of China, average life expectancy was only 35. It rose to 65 when the country began reforms and opening up in 1978. By 2016, life expectancy in China was nearly 69, surpassing that of the United States for the first time. In 2019, it reached 77, significantly higher than the world average of 72, making it one of the fastest ascending countries. A major factor in this was dramatic reductions in infant and maternal mortality. In the early days of the founding of New China, the infant mortality rate was 200 deaths per 1,000 births. By 1969, that had fallen to 83. And by 2017, the infant mortality rate had dropped to 6.8 deaths per 1,000. That's 22 points lower than the world average and 5 points lower than the average for upper middle income countries. Maternal mortality rates also plunged from 150 per 100,000 births at the early stage of the founding of New China to 80 in 1991 and 18 in 2018. There was also strong development of medical and health services. In 1949, there were just 3,670 medical and health institutions nationwide with only 30,000 beds. In 1978, there were 170,000 facilities with over 2 million beds. And at the end of 2018, there were 997,000 medical institutions nationwide, 270 times the number in 1949. By 2016, China had passed the U.S. in hospital beds per 1,000 people, with 3.8 in China and 2.9 in the U.S. Compared with 2.75 in 2011, China's seeing some of the fastest growth in this category, putting it ahead of countries such as Norway, Canada, and the UK, where numbers were falling. The number of doctors per 1,000 inhabitants has also been rising in China. The figure increased from 1.13 in 2002 to 2.01 in 2017, putting it above the East Asia and Pacific average. Health insurance has also expanded, with 95% of the population, or about 1.3 billion people, covered. In 2016, the Lancet Medical Journal ranked China 48th for healthcare access, but rising fast, putting it among the top 5 countries in the world with the strongest medical improvement.